Good morning, and thank you for joining our weekly COVID-19 briefing. Today's briefing will run until 10:30. Today, we're joined by Acting Health Commissioner Dr. Cheryl Bettigol and Dr. Stacy Callum, who's the director of our Maternal, Child, and Family Health Division. As a reminder, members of the public who would like to watch today's briefing are directed to view our live stream on the Health Department's YouTube channel. As always, we'll present remarks first in English, then in Spanish, then open it up to questions from the press. We ask that media outlets coordinate internally to make sure that only one representative asks questions and that we limit questions to 2 or fewer due to our limited time. If we have time for a second round of questions, we'll allow that. Please keep your questions focused on the topic of the COVID pandemic and the city's response today. With those instructions out of the way, Dr. Bettigol, would you please kick us off?
So good morning, everyone, and thank you for joining us today. I'd like to start us off today with a quick update on how things are going in Philadelphia. A few weeks ago, we instituted a mask mandate indoors in Philadelphia, and we announced vaccine mandates for colleges and universities and for healthcare workers that will take effect next month. Vaccines and masks remain our best weapons against this virus, and Philadelphians have been stepping up. Our data shows us a sharp increase in mask use in the city and an uptick in the rate of new vaccinations in the past few weeks. We still have a long way to go. My email inbox is full of notes from people disturbed by places they've been where people are not yet masking consistently. But the change is real and it matters. There's some evidence that we might be reaching a peak in new cases and hospitalizations. The average new cases per day yesterday was 288, down from a high of 307 last week. The percentage of tests that have been coming back positive is also going down. As recently as August 23rd, 7% of tests were positive. Yesterday, only 5% were positive. Obviously, things could change, but the numbers we're seeing this week are heartening, and we hope the trend continues. On vaccination, things are going even better. Last week, we announced that 1 million Philadelphians have received at least 1 dose of COVID vaccine. More than 2/3 of adults in Philadelphia are now fully vaccinated, and nearly 82% of adults have had at least 1 dose of vaccine. While we haven't heard any updates on an emergency use authorization for children under 12 to get vaccinated, and I know we're all waiting for that, more than 44,000 teens between 12 and 17 have received a dose of COVID vaccine. We're very excited about our vaccine numbers, which are among the highest of large cities, but we still have work to do. One group that we're very concerned about getting vaccinated is people who are pregnant. To talk more about this, I want to introduce you to the director of our Maternal, Child, and Family Health Division, Dr. Stacy Callum. Dr. Callum?
Thank you so much, Dr. Bettigol. So again, my name is Stacy Callum, and I am a pediatrician and the director of the Division of Maternal, Child, and Family Health at the Philly Health Department. So I'm here today to talk about the importance of getting vaccinated for COVID-19 if you're pregnant or thinking of getting pregnant. Now, before getting into all the science and the data, I want to acknowledge that pregnancy can be an emotional and stressful time in one's life, and that making health decisions while pregnant, especially now during a pandemic, can be really hard. And actually, I understand the stress firsthand, since I was 16 and then 20 weeks pregnant myself when I was vaccinated for COVID. So what I want to do now is share the science and data that helped me feel confident that getting vaccinated while pregnant was the safest thing I could do for myself and my baby. And I hope this information helps anyone who is pregnant also feel more confident in getting vaccinated. So first of all, research shows that pregnant people are at a higher risk for getting severely ill if they have COVID-19. This means that pregnant people with COVID are more likely to be hospitalized, be admitted to an intensive care unit, need a ventilator, or even die if they get COVID. A COVID infection during pregnancy is also a risk to the baby, since you're more likely to give birth prematurely. So that's the bad news. The good news is that we now have even more data that COVID vaccines are safe and effective in pregnancy. Over 150,000 pregnant people in the US have been vaccinated against COVID, and the CDC is really closely following over 5,000 of them. And a lot of research has been done on these vaccinated pregnant people. And from this research, we know that the vaccine works to protect you against COVID if you're pregnant. And we also know that there haven't been any safety concerns for mom or baby. Getting vaccinated while pregnant may also even help protect the baby, since the antibodies that fight COVID that are produced after you're vaccinated can cross the placenta. So because of the many benefits of getting vaccinated to mom and baby, the CDC, the American College of Obstetrics and Gynecology, and the Society for Maternal Fetal Medicine all strongly recommend getting vaccinated while you're pregnant. However, across the US, less than 25% of pregnant people have received a COVID vaccine. And in talking to our Philly healthcare providers, we are hearing that many of their pregnant patients are not vaccinated. And right now, with the Delta variant and high case rates across the country and in our area, it is even more important for pregnant people to get vaccinated. So if you're pregnant or thinking about becoming pregnant, please talk to your healthcare provider or visit phila.gov/vaccine to make an appointment to get vaccinated to protect yourself and your baby. Thank you so much.
Thank you very much, Dr. Callum. We will now have our own Ms. Zeli Colon present both sets of remarks in Spanish. Zeli?
Buenos días a todos y gracias por acompañarnos hoy. Me gustaría empezar con una actualización rápida sobre cómo van los casos en Filadelfia. Hace unas semanas instituimos un mandato de máscaras en interiores de Filadelfia y anunciamos mandatos de vacunas para colegios y universidades y para trabajadores de salud que empezarán el próximo mes. Las vacunas y las máscaras siguen siendo nuestras mejores armas contra este virus y los habitantes en Filadelfia han ido dando un paso adelante. Nuestros datos muestran un fuerte aumento en el uso de mascarillas en la ciudad y un aumento en la tasa de nuevas vacunas en las últimas semanas, pero todavía tenemos un largo camino para recorrer. Mi bandeja de entrada de correo electrónico está llena de notas de personas perturbadas por lugares en los que han estado donde las personas aún no están enmascarando de manera consistente, pero el cambio es real e importante. Hay evidencia de que podríamos estar alcanzando un pico de nuevos casos y hospitalizaciones. El promedio de nuevos casos por día ayer fue 288. Por debajo de un máximo de 307 la semana pasada. El porcentaje de pruebas que han dado positiva también está bajando. Tan recientemente como el 23 de agosto, el 7% de las pruebas fueron positivas. Ayer, solo el 5% fueron positivas. Obviamente, las cosas podrían cambiar, pero los números que estamos viendo esta semana son alentadores y esperamos que la tendencia continúe. En la vacunación, las cosas van aún mejor. La semana pasada anunciamos que 1 millón de habitantes de Filadelfia habían recibido al menos una dosis de la vacuna COVID. Más de 2/3 de los adultos en Filadelfia están completamente vacunados y casi 82% de los adultos han tenido al menos una dosis de la vacuna. Sí, bien, no hemos escuchado ninguna actualización sobre una autorización de uso de emergencia para que los niños menores de 12 años se vacunen, pero más de 44,000 adolescentes entre 12 y 17 años han recibido una dosis de la vacuna COVID. Estamos muy entusiasmados con nuestros números de vacunas, que se encuentran entre las más altos comparado a otras grandes ciudades, pero todavía tenemos trabajo que hacer. Un grupo que nos preocupa mucho con las personas que están embarazadas. Para hablar más sobre esto, quiero presentarles a la directora de nuestra División de Salud Materna, Infantil y Familiar, la doctora Stacy Callum. Ahora, las palabras de Stacy Callum. Gracias, mi nombre es Stacy Callum y soy pediatra y directora de la División de Salud Materna, Infantil y Familiar del Departamento de Salud Pública de Filadelfia. Estoy aquí para hablar sobre la importancia de vacunarse contra COVID-19 si estás embarazada o pensando en quedar embarazada. Ahora, antes de entrar a la ciencia y los datos, quiero reconocer que el embarazo puede ser un momento muy emocional y estresante en la vida de una mujer y que tomar decisiones de salud durante el embarazo, especialmente ahora durante una pandemia, puede ser realmente difícil. Y en realidad entiendo esto, estrés de primera vez mano desde que tenía 16 años y luego durante 20 semanas de embarazo, cuando me vacunaron contra COVID. Lo que quiero hacer ahora es compartir la ciencia y los datos que me ayudaron a sentirme segura de que vacunarme durante el embarazo era lo más seguro que podía hacer por mí y por mi bebé. Y espero que esta información ayude a cualquier persona que esté embarazada a sentirse más segura de vacunarse. Primero, la investigación muestra que las personas embarazadas tienen un mayor riesgo de enfermarse gravemente si tienen COVID-19. Esto significa que las personas embarazadas con COVID tienen más probabilidades de ser hospitalizadas, ser admitidas en una unidad de cuidado intensivos, necesitar un ventilador o incluso morir si contraen COVID. Una infección por COVID durante el embarazo también es un riesgo para el bebé, ya que es más probable que dé a luz prematuramente. Así que esa es la mala noticia. La buena noticia es que ahora tenemos aún más datos de que las vacunas contra el COVID son seguras y efectivas durante el embarazo. Más de 150,000 personas embarazadas han sido vacunadas contra COVID y la CDC está siguiendo de cerca a más de 5,000 de ellas. Y se ha realizado mucha investigación sobre estas personas embarazadas, vacunadas, y a partir de esta investigación sabemos que esa vacuna funciona para protegerte contra COVID cuando estés embarazada y no ha habido ninguna preocupación de seguridad para la mamá o el bebé. Vacunarse durante el embarazo también puede ayudar a proteger al bebé, ya que los anticuerpos que combaten el COVID que se producen después de la vacunación pueden atravesar la placenta. Debido a los muchos beneficios de vacunarse para la madre y el bebé, la CDC, el Colegio Americano de Obstetricia y Ginecología y la Sociedad de Medicina Materna Fetal recomiendan encarecidamente vacunarse durante el embarazo. Sin embargo, en los Estados Unidos, menos del 25% de las personas embarazadas han recibido una vacuna contra el COVID. Y al hablar con nuestros proveedores de atención médica de Filadelfia, estamos escuchando que muchos de sus pacientes embarazadas no están vacunadas. En este momento, con la variante Delta y el aumento de casos en todo el país y en nuestra área, es aún más importante que las personas embarazadas se vacunen. Entonces, si estás embarazada o estás pensando en quedar embarazada, habla con tu proveedor de atención médica o visite a phila.gov/vaccine para hacer una cita para vacunarse y protegerte a ti misma y a tu bebé. Muchas gracias. Thank you.
Thank you very much, Zelly. We'll now move to Q&A. Again, reporters are asked to limit their questions to 2 or fewer and ask that you stick at the topic at hand. If there are any reporters who do not get the opportunity to ask questions, please follow up by email and we will get you an answer. As a reminder, both Drs. Bedigol and Callum are available to answer questions today. First up, we'll go to Lauren Make from Channel 10. Go ahead, Lauren.
Hi, good morning. Dr. Bedigol, this is the first time we're hearing from you since school started. So what I wanted to ask you was, what are you seeing in Philadelphia schools, and have there been positive tests that have required students or staff to quarantine?
So, I would defer to the school district on what they want to release on specific cases, but I will tell you, we're going to see cases in schools. I've said this before, and our schools team is working with the school district on how to address those. We've got over 100,000 kids in school, so we would expect to see some cases. We are not seeing major outbreaks at this stage, but this is all going to be something that has to be managed for us to keep kids in school and learning. So I again, will defer details to the school district.
President Biden is going to be announcing today several things, including a call for all schools to institute regular testing. Will the health department be part of that in Philadelphia schools, and what will that look like?
So we've been talking with the district about testing, particularly testing for kids in higher risk activities. So, kids who are taking part in activities for which they can't mask, for example, choir, playing wind instruments, for those kids to be tested twice a week. We've also talked with the district, and they've agreed to do testing for the classrooms of kids who are not able to mask because of disability. So there will be testing happening in the school district schools. They have funds to make that happen and tests available to them. And then we're working with the other schools in the city as well to arrange for testing to be available in those settings.
Thank you.
Thank you very much, Lauren. Next up, we're going to go to Maggie Kent from Channel 6. Go ahead, Maggie.
Hi, good morning. Just wanted to get your take on the other announcement we're expecting from the president today in terms of the mandate for federal employees and contractors to get vaccinated and what you expect to see there. And do you think this will mean that there will be other federal mandates to come?
I mean, obviously, it's difficult for me to predict what federal mandates will come. You know, I will say that the more people who are vaccinated for whatever reason they get vaccinated, the safer we all are. And I know that it's challenging for lots of people who still have concerns. We are happy to answer any questions people have about the vaccine. But certainly, as numbers of people vaccinated go up, we do see safer conditions for everybody.
Sorry, Maggie, you should be able to unmute now.
Thank you. In terms of the quarantine hotel situation that we're seeing, I just saw an update from the Department of Health today asking for donations and things like that. How many quarantine hotels are still open? What capacity are they in right now? And what are you seeing in terms of cost and effectiveness with these hotels? Are they still being utilized?
So we have one hotel that we're using for isolation and quarantine. We have had plenty of capacity at that hotel. You know, it's been useful for the people who need it to have a place that they can safely go and not expose others around them, family members. But we haven't seen heavy utilization. So I don't know if that fully answers your question, but the costs are reimbursed by FEMA. So it's not a cost that the city is bearing.
Okay, thank you.
Sure.
Thank you very much, Maggie. Next up, we'll go to David Melander from Philly Sports Now. Go ahead, David.
Dr. Bettigo, I got a couple questions for you. One, is there any fallout from the Made in America Festival? Did everybody follow the mandates that were asked for it?
So we deliberately layered protections, and we've talked about this before. I've talked about this before in terms of layering mitigation strategies being the most effective. So the requirements were either vaccination or a negative test. And then we also asked that everybody be masked. And I think I've seen, and certainly you've probably all seen pictures of people who did not follow the mask requirements. The reason we layer strategies is that we know that, you know, implementation and enforcement are often imperfect. The reason that we were comfortable having this event is that we had looked at what happened with Lollapalooza in Chicago, which was also an outdoor packed event. They didn't require masking, but they did require vaccination or test, you know, kind of a similar setup, and didn't see a big wave of cases after that. So, you know, I think we're always concerned about everything right now, but in general, outside is so much safer than inside, that together with the layered mitigation strategies, we're not anticipating seeing a big rise in cases. Certainly, we're going to be watching the numbers, and you know what we see will inform other decisions. But you know, so far, and I know because I'm sure you've heard, and I've certainly heard that there were some people who didn't follow directions. Yes, that will happen. But overall, that mitigation keeps people safer.
And with President Biden going to be announcing some new COVID things today, will the city of Philadelphia be having all their high school athletes be tested as well?
So the testing for athletes depends on whether they're vaccinated or not. So you know, a fully vaccinated high school athlete wouldn't need regular testing right now. You know, it depends obviously on the situation with the pandemic. So and that's something our schools team will work out with the school district.
And last one for me, with high school football in full gear, college football is in full gear now, are there any plans about issuing a mask order for outdoor stadiums because of the concern of all the people jammed inside?
So, you know, that's something that we have talked about. It's not something that we are doing today. And as with everything, we're watching the numbers. Right now, the numbers I wouldn't say they look good because we have more cases than we want, but they have flattened and started to decrease a little bit. That's a moving target. We'll be watching it closely.
Thank you very much, David. Next up, we're going to go to Pat Loeb from KYW. Go ahead, Pat.
Dr. Bedegal, are you keeping track of breakthrough cases, or do you have any data on how many of the new cases are among vaccinated people?
Yeah, we do look at breakthrough for cases, for hospitalizations, for deaths. You know, overall, the vast majority of cases remain among unvaccinated people. As is true in the rest of the world, and as we would expect, as vaccination rates go up, the proportion of cases among among fully vaccinated people will rise, but the ratio still, you know, people who are unvaccinated remain at much, much higher risk, particularly for severe outcomes, including hospitalization, ICU admission, and death.
Okay. And with the numbers going down, do you feel like there was a little too much exuberance in July when the cases got so low and everybody unmasked? Do you think even if the cases go down that low that we should maintain a mask mandate indefinitely?
You know, I have given up trying to predict the future. I think most of us have at this stage. I think Delta was the piece of this that was different from what we've seen before. And so I think what we do with the mask mandate is going to have to depend not only on case numbers, but on what we're seeing with other variants and this variant, what we're seeing around the country. You know, if the whole country were to see low rates, then I'd be much less concerned about exuberance than if we are seeing, you know, raging fires of cases everywhere except here. So, you know, it really depends on the overall situation. We all would love to see a time when we can take our masks off, but I don't think we're going to be there for a while.
Okay. And do you have concerns about the new Mu variant?
So, I mean, you know, I have some concerns about it were it to spread widely. I think we have to watch it closely. We're concerned about any additional variants. You know, there will be, as long as most of the world remains unvaccinated, we are going to see more and more variants come. And the answer to that is vaccination widely in this country, you know, particularly in the pockets of the country that remain unvaccinated, even the pockets here in Philly, and then vaccination around the world. That's where most of these variants are going to come from, is outside the US. So until we are effectively vaccinating everywhere, we are going to continue to see new variants and variants that could evade our vaccine.
Thank you.
Thank you very much, Pat. Next up, we're going to go to Laura McChrystal from the Inquirer. Go ahead, Laura.
Hey, Dr. Bedegal, you said, you know, that the numbers look encouraging as of now, but obviously that encouraging sign comes as we head into fall and school starts. Are you expecting and/or planning for another surge? Like, what could we expect this fall and winter to look like?
Yeah, I mean, you know, I think one of the lessons of the pandemic so far is that we need to be prepared for anything. And so we are planning for what to do if numbers surge again so that we're ready. At the same time, we don't want to be more restrictive than we have to be. So yes, but with that, you know, that caveat, with vaccine numbers rising, I'm hopeful that we can avoid a big surge, but we you know, time will tell.
Okay, and have you been contact tracing cases, you know, recent cases, and has that given you any insight into sort of where and how people are currently getting it, who are getting it?
Yeah, I mean, we are not able to contact trace every case at this stage, but from the cases that we have been contact tracing, we know that, you know, the majority of people who get COVID get it from a close contact, often at home. And so it's from a family member or somebody who comes and visits in their home. I think we are all programmed to trust the people close to us and not trust the people farther from us. And so we tend to be much better at taking precautions with people that we don't live with, people that we're not close to, and not thinking so much about, you know, a dear friend who comes over, a family member who doesn't live with us who comes over. That's where exposure is happening. People let their guard down, they take their masks off, they have a meal together with somebody they don't live with, and now you have cases spreading. And so, you know, I get much more email concerned about somebody passing somebody else on the street without a mask on. That's not where this is getting passed. This is getting passed in people's homes. So I think we all need to be cognizant about, how we're socializing. If we're starting to have parties in our homes or, parties in closed indoor spaces again, that's where real risk is happening.
Okay, thanks.
Thank you very much, Laura. Next up, we're going to go to Isabel Sanchez of Telemundo. Go ahead, Isabel.
Hola, ¿qué tal, Celi? Me dijeron que tú podrías traducir la pregunta. Nada, mi pregunta es acerca de quiénes están siendo hospitalizados en estos momentos, cuál es el grupo de edad y qué tan preocupantes son el número de hospitalizaciones en estos momentos.
Bear with us one second. Let me see if I can.
Yes, I'm here.
There we go.
Me gustaría, this is for Dr. Vertigo. She would like to know who is getting basically tested, what's the group that's getting the highest group that's getting the actual virus and the age group, and what are we doing about that?
So the highest rates remain among young adults 20 to age 34 and among Black adults in the city. So the young Black adults who are our lowest vaccinated group. And because of that, we are targeting our vaccine clinics and efforts and our community outreach efforts to that population. For people who are 45 and over, we have eliminated disparities. We still have more people to reach in those age groups, but it's more evenly spread across the population. But it's our young adults who are getting this right now. And I think it's because people have gotten a little bit careless, and that population has not been as motivated to get vaccinated because they think this doesn't affect them. But from what we're hearing from the news all around the country, we know there are young adults in the hospital, young adults in the ICU, and young adults dying of COVID. And we really need our young adults to get their vaccines.
El grupo que ha sido más afectado son jovencitos entre la edad de 20 y 24 años y especialmente en el grupo afroamericano. Es una población que necesitamos acercarnos a ellos para dejarles saber la importancia de vacunarse. Y también tenemos que tener en mente el grupo de 45 y más de edad, y porque hay disparidades, y lo que creemos ahora es que necesitamos que la información acerque a la población que son más afectadas.
Perfecto, gracias, Eli.
De nada.
Right. That's everything, Isabel? Excellent. Thank you very much. All right. And since we are hitting 10:30 and I'm not seeing any other hands raised, I just want to thank everyone for their time this morning. We will conclude today's briefing right now. We'll announce next week's briefing via Twitter and media advisory when a time and date are set. Thank you again for joining us. Stay safe.